Mary Stiles, and the disease I chose to research for our project is rheumatoid arthritis, also known as RA. What is RA? It is a chronic autoimmune disease where the immune system mistakenly attacks the body and healthy joint tissue. This includes the synovial lining inside of the joints, where the bones connect to the joints and allowing motion. The chronic inflammation leads to pain, swelling, stiffness, and eventually joint damage if not properly managed. You may wonder who is able to diagnose and treat RA. A rheumatologist is a specialty provider that is able to diagnose and properly treat patients with moderate to severe RA. An important note to add is that early intervention and proper treatment is extremely important to prevent joint and organ damages. All of this information is supported from articles published by the Mayo Clinic and the JAMA Network. For etiology and risk factors, the Mayo Clinic states that exact cause of RA is not understood. It is believed to have developed through a mix of genetic susceptibility and environmental triggers. Some factors are being a female, having a family history, smoking, obesity, and so on. Author Macmillan from the Health Central published an article speaking on the etiology of RA. It is not contagious or transmittable, and unfortunately, RA is not curable. But according to author Macmillan, he discusses how there are 4 stages of RA, and in this section, I added an image of all of the stages: preclinical, early, late, and end stage. This section is supported by Arthritis Foundation and Mayo Clinic. The signs and symptoms include joint swelling, stiffness, fatigue, pain, and decreased range of motion. It often begins in the small joints of hands and feet, but also organs such as your eyes, heart, and lungs are affected due to systematic inflammation. I found an image from the Cleveland Clinic that shows a map of all of the affected parts of the body that you can see to your right. Diagnosing RA involves combining physical findings and blood tests and imaging. Some of the blood tests are testing for white blood cell count, inflammation, anti-CCPs, etc. X-rays, MRIs, and ultrasounds are also used to help detect joint erosion, and using them together can help rule out RA. Here you can see an image from the Alberta Health website that shows an X-ray from a human hand with and without RA. And all of this research is provided from the Cleveland Clinic and the Mayo Clinic. For treatment, the goal of treatment is to control the inflammation and slow disease progression. So here I listed a long list of steroid and non-steroid treatment options, and all of the treatment research is based on data that is found from Health Central online, the Arthritis Foundation, and the Cleveland Clinic. Complications and deformities, some of those commonly known ones for rheumatoid arthritis listed by the NHS UK online are carpal tunnel syndrome, Sjögren's syndrome, which is dry eyes and mouth, vasculitis, blood vessel inflammation, and osteoporosis. If RA is not treated early, the prognosis is not good. The chronic inflammation can permanently damage your tendons, ligaments, cartilage, and so on, which lead to deformities. Some examples of the deformities are ulnar deviation, swan neck deformity, and Boutier deformity, and they can all affect your hand function. The Cleveland Clinic also states that joint damage and loss of mobility is a short life expectancy or examples of lack of treatment. And this information is supported by the Mayo Clinic and Cleveland Clinic. For my statistics section, everything listed is found from the CDC Gov. They give several great examples of demographics and prevalence of RA for individuals varying in age, gender, ethnicity, and race. There are several examples listed in my stats section. One I will point out is the pie chart that shows a wide range of different age groups there with a heavy prevalence of RA for the 70 and up age group. And the second graph, bar graph, that is purple, shows a different race and ethnicity group for each one and the percentages of prevalence of RA for each of those groups, with the highest being Caucasian at 21%. To conclude this presentation, even though RA is a lifelong disease, early diagnosis and treatment can significantly improve the outcomes and help prevent long-term joint deformity and disability. With many modern treatments options available and a healthy lifestyle, individuals with RA are able to continue working, staying active, and maintaining daily function. I also included a complete list of all of my